For some analysis on all of this, we're joined by Susan Glasser, who is the editor of Politico, plus Gerald Seib, the Washington bureau chief of the Wall Street Journal, and Jeffrey Kluger, who is the editor-at-large of Time magazine. And Jerry, I want to start with you. You know, as long as I've been in Washington, the people at the White House, whoever the White House happened to be occupied by at that point, would say, look, the White House is wherever the president is. The president can operate from any place. But last week, at the end of the week, we saw the president deciding he better stay home for a while. Is this a sign that there's a new attitude there, that things are kind of changing?
Well, I think it's a sign that the optics weren't working very well for the White House, you know, and there was a Saturday night meeting last night, and a statement put out late last night saying the president met with his advisors, about 18 of them. Well, that's a sign that they want to send a signal to the American public, we're on the case. Now, this is tricky because you have to make the case that you're in charge and you're on the case without inciting panic, and that's the difficulty for the White House. I find one of the ironies here is that President Obama actually was on this fairly early. Way back in early August, there was a summit of African leaders here in Washington. He talked about it then. He talked about it at the UN General Assembly in early September, yet somehow it got away from them in the last couple of weeks.
I thought it was interesting, Susan, that somebody at the White House leaked to the New York Times that the president was seething about all this. They found that necessary.
Well, there's a long history, I think, of the president being very angry. Not just this president, but any president. You know, that's the kind of story that you see when you're worried that the narrative is getting away from you. You know, and I think they're very eager right before the midterm election. And let's be honest, I think that the political timing here really is affecting what you're seeing in terms of Washington's response. And so the White House is very eager to make sure this doesn't play into an existing narrative around government competence and our lack of faith in government institutions. Unfortunately, it might be.
Jeffrey, but beyond the optics and all of that, is what the White House doing now? Are they getting a handle on all this? I mean, you saw the Republicans are all in the dither because the man they picked as the so-called czar turns out not to be a person with a health background.
Well, that is true, but it's important to remember that Ron Klain's job is not to be the nation's doctor. His job is to be the expert implementer. And in fairness, that's a very important role when you have a sprawling infrastructure that's devoted to dealing with this very, very tricky disease. His job isn't to control the virus. His job is to deploy the people who can then control the virus. And remember, when we're dealing with a virus, we're dealing with sort of a mindless clump of nothing that knows how to do one thing: replicate itself and spread. Now, talk about asymmetrical warfare. So you need to be able to deploy as many people as possible with as many different skill sets as possible to attack it.
I want to ask both of you about this whole situation with the Surgeon General. It's been a year now since the president nominated someone to be the Surgeon General. That post is now being filled by an acting Surgeon General. Tell me what this is all about, because I know this is a story that has about 9 different sides to it here.
Well, I mean, this is the other epidemic in Washington, the epidemic that you talked about, the inability to get anything done. It is rampant here, but this particular example had to do with, of all things, gun control and the statements that the nominee had made about gun control, so it's gotten wrapped up in that issue, which seems wholly unrelated. It's just one of a long list of appointments that haven't been approved by a Senate that just doesn't work very well. So if you're looking for Congress to step into the breach here and do something about any crisis, you're probably looking in the wrong place right now.
About the only thing we can say is I think the new CBS poll has Congress's ratings right now around 9%. So, you know, the consequences of inaction on the one hand seem to be toxic approval ratings. On the other hand, we're a few weeks away from an election in which the vast majority of members of Congress are going to be reelected. So I think that just feeds into this feeling that there's such a disconnect.
Well, I sort of referred to this earlier in the broadcast, but the fact is this new poll has some very dismal findings here. I mean, people don't seem to have much confidence in any institution anymore, and I think this probably goes beyond government, but just a couple of things. They still like the FBI. 51% of the people think the FBI, they have a favorable rating. The Central Intelligence Agency, below 50%. Department of Homeland Security, Environmental Protection Agency, they're down to a cool 39% in favorable. Secret Service, they're down to 38%. Centers for Disease Control has now fallen below the Secret Service in the confidence that people have. They had 37%, same with the Food and Drug Administration. The IRS, which should be, it seems to me, the one agency that we all have confidence in, only 31% have a favorable rating there. And then, of course, we had the Veterans Administration. We know about all that. Jeffrey, I think this is a very serious problem. And as I just said, I think this may be more serious than the Ebola crisis.
Well, I think it is, but I think it also, there's a certain luxury to condemn the institutions that basically have been functioning for a long, long time. Look, we have 9,200 infections in Africa. We have 4,555 deaths, and we have 5 cases in the U.S., and most of which have been handled well. We're in a position, we as a highly developed Western country have the luxury of criticizing our institutions, and people keep holding the Apollo program as the gold standard example. Why can't the fight against Ebola be the Apollo program? Well, the Apollo program wasn't always the Apollo program. We lost 3 people in a launch pad fire. We nearly lost 3 people on Apollo 13. It's only in retrospect that we say this was the perfect Swiss watch functioning organization. I think when the long history of the Ebola crisis is written, we're going to look back and say, yeah, there were some stutter steps. We were trying to find our way in a very murky situation, but we got it under control and we made this work. I just think we have to stop finger pointing and blame laying when we're in the middle of a crisis.
But what disturbs me, and what I think what bothers me, is that these institutions, so many of them, I mean, people have just lost confidence. I mean, you know, the things you used to accept, I mean, and took for granted, you're now surprised when it works out right.
Yeah, and I don't know if we're living in an age of skepticism or an age of cynicism, but it's one or the other, and it's not just government, Bob. You know, your own poll shows, ours have over the last couple of years, it's other institutions in society. It's churches, it's the police, even the Supreme Court, which used to be above what the sort of the dirtier politicians were doing. Well, it's plummeted in public approval as well. And you have to admit that the series of government missteps, starting with Hurricane Katrina, I suppose, but you've got a VA scandal, an IRS scandal, you had the botched rollout of the healthcare website, and now you have White House intruders jumping over the fence. Well, these are all feeding what I think was already going to be there anyway, which is a lot of skepticism that now is probably morphing into cynicism about institutions in the country.
Do you think it has anything to do with social media and the fact that we're just bombarded with all this information 24 hours nonstop?
You know, I do think it has something to do with human nature, which is to construct a narrative. And now we have so many more data points to plug into that narrative at any given time. We hear about things we might not have heard about in the past. And then there's also our political process. Look at how quickly Ebola has instantly morphed into a political issue in our House and Senate campaigns. I mean, you can almost chart a relationship between the more embattled and endangered the incumbent and the more quickly he or she has been to endorse a travel ban, for example, on flights from West Africa, purely political grandstanding, if you listen to the experts. And, you know, I think that undermines confidence as well, that politics is really much more theatrical at a time when it's fairly clear Congress isn't going to be contributing anything meaningful in a legislative or an oversight sense to combating this Ebola epidemic.
All right. Well, thank you all very much to help us put it into some context anyway. Enjoyed talking with all of you. I'll be back in a moment with a report on that other story, Iraq.